our children. I will also say every single school in British Columbia has had a ventilation assessment, and we continue to make that a priority. We have a committee that is continuing to meet weekly to review what's happening in schools. We're monitoring absenteeism, and schools remain a supportive, inclusive environments where masks are available in every class and where it is accepted and encouraged to wear a mask whenever people feel they need to. But I think we all need to recognize we are all human, and masks are protective equipment, but they're only as effective as we make them. And that can be a challenge, especially for children sometimes. And I do not believe we need that heavy hand of a mandate to send a clear message that masks are an important tool that we can all use during this time and in every respiratory season. We should have one with us. We should use it in situations where it makes sense. And it may differ depending on the situation. I think about it, I may wear a mask one day on the bus if it's crowded, the windows are closed, or if I'm worried that I might be getting the sniffles. But on another day, if I'm feeling fine and there's lots of space and good ventilation, I may choose not to, and that's okay. I think those are the decisions we have to bring masks in as a tool that we can use when it's appropriate, when it's necessary. If I have a sick child at home, I may wear a mask in my workplace to be extra cautious, even though I'm feeling well and I need to go and I can go into work. Or I may participate in a meeting where there's more people in a crowded setting remotely rather than in person. The settings where masking continues to be essential are in healthcare settings. And we have a mandate in all of our healthcare settings across this province at all times. These tools are necessary all the time. So we have vaccination requirements for healthcare workers across our healthcare settings in this province, and everybody in long-term care, hospitals, vaccination clinics, community clinics wears masks throughout this respiratory season. These are important additional measures in those places where it matters the most. And additional measures we have in long-term care are including that residents are protected through testing and ensuring visitors are also vaccinated.
Vaughn Palmer, Vancouver Sun.
Is there any hesitation over bringing back a mask mandate because of the view that the public has moved on and it would be hard to enforce the mask mandate even if you brought one in?
I think I tried to explain that mask mandates were in the context of where we needed them to be worn by everybody over broad areas, over broad settings, in the context that we were in at the time. So I don't see a mandate as being required by itself right now in the situation that we're in. We all need to learn about that tool and where it is best used. And we're trying to provide some guidance on that. And that's what we all need to focus on, because this is going to happen every year. We're going to have respiratory season next year. And masks are one of the tools that are important, that work, that help in the situations where we use them most. So if we're not feeling well, if we're going into a crowded situation with poor ventilation, where people we don't know, those are when we need to wear masks. And that will continue. So right now, I don't see the need for a mask mandate by itself, because we have many other tools and we have a high level of protection from a variety of these respiratory illnesses that are circulating right now.
Is there any in particular, of all the metrics you monitor, is there any in particular that would contribute to you changing your mind on this?
Yeah, we've talked about that a lot. When it wouldn't be a mask mandate in isolation, it would be what are the measures we need to take to prevent people from getting sick and overwhelming our healthcare system, prevent morbidity and mortality, sickness and death. And so the situations that I can see would be an entirely new virus for which we don't have immunity anymore, where every single one of those tools needs to be in place in a broad way across the population. So it would be in the context of other things that need to be in place too, like capacity limits and restrictions in certain activities and all of those other things that we needed to do when we didn't have protection against something that was causing very severe illness in large numbers of people.